Hello, and thank you for the opportunity to present at your conference today in relation to the protection of children. My name is Derrick, and I speak to you today in my capacity as the Vice President of IFCO, which is the International Foster Care Organisation. IFCO is a global not-for-profit networking organisation serving to promote and support family-based foster care across the world with a 40-year legacy of making a difference in civil society. Our organisation comprises a multicultural collaboration of foster and kinship carers, social workers, parents whose children are in foster care, care leavers, academics and professionals, researchers, media and policymakers, and many more. IFCO's vision is driven by the belief that, if they so wish, all children in alternative care across the world should live in family-based care because this form of care offers children the best opportunity to grow and prosper. There are four key beliefs that underpin this vision. One, that alternative care for children should be child-centred and family-focused. Two, that in all decisions about children's care, the needs and rights of the child should be the primary consideration. Three, that children should have a say in all decisions made about their lives. And four, foster and kinship care should be an inclusive effort by all. Birth families, where possible and appropriate, foster carer families, professionals and agencies, all respecting the diverse contribution of each in the interest of children who are in alternative care. I shared that information with you because this is an ethos that hopefully you will see runs through this presentation. And now for a little bit of information about myself and why I'm so passionate about the protection of children. I've worked within the fostering and children's services sector in the UK for over 17 years, with 13 of those in leadership roles and 9 in an international context. I'm the Chief Executive Officer of a national care leaver organisation. And before that, I spent 5 years working as the Managing Director of a national independent foster care organisation and the registered manager with our national regulator. I was responsible for over 100 staff and associates, over 150 foster care households, and over a 15-year period we supported the care plans for over 500 children and young people in foster care. I have a postgraduate certificate in child protection and welfare, and probably most important of all, have been a foster carer for the past 10 years, and I passionately believe in the importance of protecting children in foster care. In today's presentation, I'll provide an overview of the child protection system in Scotland and the wellbeing assessment framework. I'll follow on by sharing with you some of my experience of reviewing some of our mechanisms for assessing and reviewing foster carers through the lens of child protection. Fundamentally, I hope that I'm able to convey the importance of child-focused practice that keeps children safe and supports foster families to nurture children in their care to feel safe from harm. So, child protection in Scotland. Since 1995, Scotland has made significant progress in its ambition to protect children and improve their well-being. We now have an integrated approach for how we aim to look after and protect our children, in particular through the introduction and wide support for getting it right for every child, or as it's known, GIRFIC. Key factors to this progress are detailed in a 2015 report by Brock, who considers some of the key factors to be: one, that there is the consistency of risk assessment has been improved by introducing the 2012 National Risk Assessment and Management Framework. Secondly, that Scotland has introduced a wide range of legislation, including the Children and Young People Scotland Act of 2014, where GIRFIC principles provide the best possible opportunity to intervene early to protect children at risk. Further, that legislation has created permanent status, extended entitlements to additional support for learning, and extended the age of leaving care, and provided a statutory duty to share information. The National Performance Framework includes outcomes and indicators to track progress on keeping children safe and improve their well-being. And finally, that multi-agency partnerships have been initiated to develop national improvement in working with children and families. subject to domestic violence and youth justice, and significant efforts are now underway in early years. Now, all of this has been supported by local leadership and implementation. There is now a multi-agency chief officers group in every local authority area, accountable for securing better outcomes for children locally and supporting the work of Scotland's 32 child protection committees, one for each local authority in Scotland. Secondly, there are clear local arrangements for information sharing and local multi-agency assessment and planning. There has been a consistent focus on developing and supporting a competent, trained and assured workforce, and foster carer mandatory training and evidence-based competencies in foster care reviews have been developed and standardised. For anyone particularly interested in child protection in Scotland and how it is structured, what the procedures are, for example, I would suggest you look at the National Guidance for Child Protection published in 2014. This is currently being revised for an updated version due to be published soon, I believe. Now, since 2014, the Scottish Government has undertaken a programme of continuous improvement, and this has included the launch of a Child Protection Improvement Programme in 2016 to make improvements in all areas of child protection. In March 2017, they published the Child Protection Improvement Programme report, which set out actions being taken to improve child protection in Scotland. In March 2018, they published Protecting Scotland's Children, National Policy and Child Abuse Prevention Activity. And they've established a National Child Protection Leadership Group, chaired by the Minister for Children and Early Years, to support, strengthen and improve activity on child protection. In October 2019, the Scottish Government passed what's been referred to as the No Smacking Bill to end the defence of reasonable chastisement, meaning parents and carers could face prosecution for any use of physical punishment on their children. Its primary aim is to give children the exact same protection from assault as adults. And the bill uses the same definition of physical punishment, sometimes referred to as corporal punishment, used by the UN Committee on the Rights of the Child. Finally, Scotland will incorporate the United Nations Convention on the Rights of the Child into law to the maximum extent possible within the powers of the Scottish Parliament, and is consulting on the bill currently with the aim of having it enshrined in law in 2020 or 2021. I refer back to Brock, who recognised that there has been a considerable shift in emphasis from protecting and safeguarding children to securing the well-being of every child. And it's right to acknowledge the progress that has been made towards securing the protection and well-being of children. However, child protection, early intervention and achieving every child's well-being is a process, and it is unrealistic to assume there could be an end point at which we can conclude that our work is done. I've chosen today to share information with you on the Scottish approach to child protection and well-being, but there are critiques and challenges to the system in Scotland, so I do not present this as a perfect system. Indeed, there are comparative studies across different countries internationally that I would be happy to discuss or share at future learning events, but today I felt an overview of what has worked well would be beneficial. Over recent years, thinking and understanding of how we improve outcomes has developed and become increasingly sophisticated, with an improved focus on children's rights, the role of universal services, and integrated service delivery. I shall now move on to briefly describing the national practice framework I referred to earlier, and further definition of GIRFIC. In 2006, the Scottish Government stated that less time should be spent on measuring what goes into services, and more time should be invested on what funding achieves for individuals and communities. So thereafter, there was a creation of a single outcome agreement, allowing for more flexibility at the point of delivery, and underneath this is the Getting It Right for Every Child, or GIRFIC, agenda, and the Getting It Right for Every Looked After Child agenda, both of which are now well established in Scotland as national indicators of wellbeing. According to the Scottish Government website, the national practice model is a dynamic and evolving process of assessment, analysis, action and review, and a way to identify outcomes and solutions for individual children or young people. It allows practitioners to meet the GIRFEC core values and principles in an appropriate, proportionate and timely way. It is a way for all agencies and workers who support children, young people and their families to begin to develop a common language within a single framework, enabling more effective inter- and intra-agency working. Now, there are 8 indicators in the wellbeing wheel, also known as Shinari. These are safe, healthy, achieving, nurtured, active, respected, responsible and included. And I would draw your attention to safe being the primary wellbeing indicator in the wellbeing wheel. These indicators are used to record observations, events and concerns, and when putting together a child's plan. However, the national practice model is also made up of 2 other components, the My World triangle and the resilience matrix, which are then used to gather, structure and assist in the analysis of information. The domains within the My World triangle enable practitioners to consider systematically the child's development needs, the parent's capacity to meet those needs, and the impact of the child's wider family and environment. The 3 sides of the triangle, how I grow and develop, what I need from people who look after me, and my wider world, have, however, been deliberately framed from the point of view of a child to reinforce the GIRFEC principle that children are at the centre of all the activities undertaken by practitioners. Scottish Government guidance states that practitioners working with children and young people can use the assessment triangle at every stage to think about the whole world of the child or young person. It promotes a model of practice that looks at the connections and effects of risk in one area with what is going on in the rest of the child's life. This approach allows practitioners to consider the impact of risk on children's well-being in the long term as well as the short term. Now, although I have talked in generic terms as far as families are concerned with the GIRFEC wellbeing wheel, it is also used for planning for children in alternative care. And the assessment framework referred to, the My World triangle and the resilience matrix, can be used in assessment of supporting children, young people and foster carers. For example, I introduced the resilience matrix into the matching process for any children or young people placed in my fostering organisation. This matrix enabled us to develop a child-specific support plan from the outset, specifically tailored to their needs, and was particularly useful to the social worker when considering the support needs of newly approved foster carers with their first foster child. As the foster placement progresses, this can inform any joint working between the social worker, the child, the foster carer and the agency, and is structured through the use of the My World triangle and ensures the outcomes for children are child focused and ultimately is about supporting placement stability. So as I said at the beginning of my presentation, I will share some of the lessons learned as a senior manager within my fostering agency in Scotland. I had the responsibility for the practice undertaken by the staff group and therefore had a particular interest in ensuring the professional and organisational contexts within which assessment and support is undertaken is as conducive as possible to supporting the most analytical assessments to be undertaken and recommendations preferred. This was achieved through a robust quality and performance function, developing policy and procedure that is a cornerstone for consistency and continuity in practice. And coupled with this was the development of a culture committed to weaving and challenging the personal, professional and organisational approaches to assessment, supervision and support within the agency. To support this, the management group created an environment conducive to a multidisciplinary response to foster carer reviews, commitment to regular reflective supervision, and were encouraged to develop their skills and knowledge and have confidence to refer to research in their assessments. As professionals within their own registered body, I recognised that social workers needed to enhance their own practice. The systems they work within need to support them in the task, and my role was to create a culture that supported this. By ensuring staff felt supported and skilled to support and upskill foster carers, I can be relatively confident we're keeping the protection and the voices of children and young people at the centre of our practice. I say relatively confident because despite efforts to minimise risk to children, in recent years, there have been high-profile cases across the UK and, in fact, of course, internationally, involving the harm of children. So, for example, we have the allegations of historical sexual abuse in UK football clubs, the establishment of the Scottish Child Abuse Inquiry, looking at the abuse of children in care. There was the sexual exploitation of young people in Rotherham, which is an English town, some of whom were looked after and in alternative care. And more broadly, we have the general vulnerability of looked after children who are accommodated, some of whom find themselves being abused within foster care. So I therefore made a commitment to review the robustness of our foster care assessment panel. That's the independent members who recommend a foster care approval in the UK, and foster care review mechanisms. And I did this through the lens of protecting children from harm. So I reflected on inquiry reports and findings of significant case reviews from 1945 onwards, all of which pertained to child deaths or significant harm whilst in alternative family-based care. There were a number of key messages that I drew from this. The first review of a foster carer and subsequent reviews offer opportunities to evaluate a foster carer's ability to cope and to test out the prognosis reached in the initial assessment report. A contributory cause of serious errors and omissions that have occurred and can occur through assessment seemed to be a basic disbelief that foster carers could harm a child, coupled with inadequate assessment practices. A further one was that the fear of being discriminatory can lead to failure of the ability to discriminate between the appropriate and the abusive. And another finding from the significant case reviews was that engaged carers need the same level of scrutiny as less engaged carers. It's vital that child-focused practice is open to challenge, and foster carers have an appreciation of the role of the social worker, and this has to be a delicate balance of both scrutiny and support, and I say this as a foster carer. Equally, our social workers have to be self-aware when undertaking their duties. While challenging our assessment practice, I drew on research that demonstrated that social workers can fall into the trap of class bias when working with families in the community and can bring that bias to the workplace. Foster carers tend to be middle class, and this combined with assumptions that people who foster are good people must be a potential bias that social workers are conscious of. A second area of potential bias is that of gender, where too often assessment is overly focused on mothers, leaving fathers and other members of households out of the analysis. Now, fostering, as we know, tends to be a female-dominated vocation, certainly in the UK, and this is reflected in the composition of the foster carers that were registered with my agency. In two carer households, the female carer tends to be the substantive carer, and as such, the carer the agency has the most interaction with. The challenge for the social work team is to ensure that assessment is not gender biased. And additionally, a challenge for the agency is to ensure that our system of work is not gender biased. I undertook an audit of foster care reviews and identified that our second carers in households, approximately 97% of whom were male, were not undertaking the level of required training. Now, in discussion with teams, I was advised of a level of disengagement by male carers who were not attending supervisions, support groups, or training on a regular basis. Through consultation and relationship-based practice, we, as an agency, had to be open to the feedback that we were not accommodating their needs. Most worked full-time, but training and supervision, for example, were usually held through the day. So we amended our practice and our operational activities to improve this. We had inadvertently created a barrier to their involvement and had to take responsibility to change this for the sake of supporting and protecting our carers, as well as the children and young people they cared for. It's also hard to hear, but there is research evidence that a minority of foster carers should never have been allowed to foster. They may fail to show warmth or care, or may be responsible for very serious abuse or neglect. Thus, the risk of abuse in foster care can also be increased by poor assessment, supervision and support. So in my role, I would undertake a distance analysis of all new carer household assessments and annual foster carer reviews. I audited supervision records of foster carers and staff for quality, as well as compliance, and I reviewed the supports in place to support, scrutinise and supervise the carer group and the staff. Finally, in the review I undertook of our foster carer reviews, I learned that we must avoid being overly prescriptive and ensure analysis remains core to the social worker's report. So we revised the template for the social worker report to ensure an emphasis on assessment and analysis, with supporting evidence of annual checks having been undertaken. And this was turning it on its head compared to where compliance had driven practice. This has resulted in stronger evidence-based analysis of the competencies of foster carers, which has been vital to ensure a robust process that continues to challenge the supervisory relationship between social worker and foster carer, especially those that have been working together for a number of years. Another revision to the procedure has been to include contribution from the helping team. And this may be therapy, education officers, or children and young people support workers. They provide a written report to contribute to the annual review, which further supports a robust assessment, as it includes the evidence and assessment from other members of the team, providing a holistic assessment, and both facilitates the views of the young person, should they wish to express them to someone other than their social worker. But it also ensures that the carer's practice is child-focused and effectively safeguarding from the perspective of a multidisciplinary team. As I've said, while it is an uncomfortable truth that children in foster care have and will be abused by their foster carer, it is unlikely that they will disclose this in a report to contribute to the foster carer review. But the culture of direct work with children and young people to support an environment where they can speak to the social worker or a member of the multidisciplinary team is essential, and foster care reviews are a further mechanism in the prevention and protection of children. Now finally, one of the competencies foster carers in Scotland are evaluated against is their commitment to learning and development. But as I've indicated, we had areas to improve on this. So we introduced an annual initiative to complete mandatory training, which includes child protection training annually, as well as developmental opportunities. We trained foster carers to become trainers and developed a steering group where carer representation and feedback shaped the content and delivery of our programme. And this was recognised by our regulator as having transformed our culture on learning and development, but also most importantly, that this was having a direct impact on improved outcomes for children and young people. I would like to take this opportunity to thank you for your attention during this presentation, and I hope in the brief time that we've had that I've been able to provide you with an overarching context to child protection in Scotland, with some of examples of how it is the practice, the sector and organisational culture, and that complicated balance of scrutiny and support that is required to embrace the amazing work that foster carers do every single day, but that always keeps children's well-being the heart of all that we do. And if anyone has any questions about my presentation today, or is interested in learning how IFCO can support you, please do not hesitate to contact me on email at vice-president@ifco.info. Thank you very much.